Okay.
You're on.
Okay. Okay, Deidre, we're good? Okay. Call the Mason County Board of Health regular meeting of July 23rd, 2019 to order. Welcome, everybody. Anybody need any introductions? I think we're all part of the family now. I think we're good.
We have a guest back there.
I'm Tom Davis.
Oh, hi, Tom. Well, thank you. Let's just go ahead and introduce ourselves for the benefit of Tom. Should I
Gary
start?
Clues, I'm representing the Fire Commissioners Association and Fire Commissioners Association.
Carrie Davidson, I'm with the Shelton School District.
Scott Hilbert, Board of Commissioners at the hospital.
Peggy Van Busker, Board of Commissioners for Mason County Public Hospital District 2.
That was a mouthful.
Wow.
You should see the business card. It says over.
Lydia Buhite, Mason County Public Health.
Oh, Allison Smallwood, Mason County Public Health.
Kevin Chuy, Mason County Commissioner.
Sharon Trask, Mason County Commissioner.
David's missing.
Okay.
I make a motion, we approve the agenda as presented.
Thank you. Is there a second?
I second.
Thank you. All in favor of approving the agenda as submitted, signify by saying aye.
Aye.
Aye. Motion's carried. Thank you. Got approval of the minutes of May 28th. Have you had a chance to look at those minutes?
Yes. I make a motion, we approve the minutes as submitted.
Okay. Is there a second to that motion?
I didn't attend, so
You can't do it.
I'll say.
Thank you. All in favor of approving the minutes of our Board of Health meeting on May 28th, signify by saying aye.
Aye.
Aye. Motion is carried. And we'll get those passed around here. Health officer who's not here,
He's
you got
not here.
anything to say on his
So
behalf, Dave?
I did talk this week. He's working a couple of cases, so he has jumped in with both feet, or maybe the job has jumped on him. I'm not sure how that goes exactly, but he's like, yeah, that's kind of the case.
He's jumping
I got with Department of Health and put together a booklet for all the RCWs and WACs that a health officer should be aware of, and it's about that wide, like that. It's big ledger and about that thick. So we printed off a copy for him and a copy for me, and he's taking it as his homework.
Jeez.
He's got about 90 days until his patient, he's already got the patient schedule. So it's gonna take about 90 days to work through that and get his alignment so he can have a full day with us. He has been coming in at least once a week and spending time with us, but it kind of varies.
Good.
We put together a new office for him up front by the biostatistics desk, and then right by the community health group. So the work that he does is most closely associated with the nurses and behavioral health and those folks. So he's right there with them, and they'll have better access to him now than they had before. So
Good idea.
I think it's going to work out really well where he's at. He's already connected with 2 other health officers, actually 3 health officers, to do some mentoring. So that's Alan Melnick, and then from Tacoma, I'm not from Olympia,
Dr. Woods.
Dr. Woods, and then from Kitsap as well. So he's got kind of some local perspectives on both sides, which is helpful. And he's working a TB case. He's in and going,
Good.
doing health officer stuff. So it's good to see.
Good.
And I'm much relieved that we have somebody in place who's looks like he's going to stick around for a while. He's requested a reduction in his FTE from his work so he can dedicate more time to us. So,
Good.
I
Great.
was really tickled when he made that announcement. So
Good.
we worked through all the legal and all of the administrative pieces that he had to jump through to get on board, and it's from now on it's just kind of learning the job and moving forward. So
He's got a good team to help get him through that learning curve.
He's fun.
Is he?
A lot of fun.
Look
Very
forward to
different
meeting
than
him.
Dr. Yu, but a lot of fun.
Good.
He doesn't like to be called doctor, right?
No, he's Dan.
How's he
It's
feel
very
about
hard.
how's he
for
feel
us
about
to do
Zumba?
that. No, we haven't talked about
But-
Zumba. Good
He
question.
does ride his motorcycle to work.
Yes, he
Yeah.
rode his motorcycle.
Yeah.
Already?
Yeah.
Yeah.
So he's, as he gets settled, he'll start doing his health officer report as he's connecting
Right.
with the other health officers.
Good.
So I do hope to get him to go to the fall Wasafo conference and spend some days with his cohorts.
Yeah, great.
So,
Bring back some good ideas. He'll be here just long enough to have some questions at that point in time, on how to
Mhm.
put the things together, so it's good.
mhm.
Can I ask a question?
Sure.
How does he get connected with the other health officers?
So I connected him with Alan Melnick, who is the chair of the statewide Health Officers Association.
Okay.
So, and then he already knew Dr. Woods, and we just started introducing him around
To-
the group.
Okay.
So,
I happen to know the one down in Aberdeen, Dr. John Boucher, and
Mhm.
know that he lives fairly locally up here in Cotton Shores. So I
So-
just wasn't sure
so
if there
the-
was any.
So the way the SOFO is organized, Washington State Association of Local Public Health Officials, is we have the health officers have their forum, we have the administrators, which is the it's called ELK Executive Leadership Committee. There's the community health, or the CHELC,
Chalk.
and there's the environmental health directors,
Okay.
and now there is communicable disease group and an assessment group.
Okay.
So when we have people in leadership positions who come into this, to their leadership positions, we have associations we can hook them into
Right.
with mentoring programs that gets them up to speed and
Well,
rolling.
that's
So
good to know.
that's the best part of that organization, is it really takes care of its own.
Okay.
Sounds like you've got it covered, Dave, but is there anything we can go ahead and do as a board to help bring its transition on into the community a
Well,
little easier?
I think as he gets settled, we need to connect him with Peninsula, we need to connect him with Mason General.
So he's
That-
meeting with Mason General, at least one person this week. I've got him scheduled. He's
Okay,
meeting with
super.
Terry.
So we're starting the process.
Yeah,
Good.
but the medical association, getting him connected in with all
Okay.
the docs would be important.
Mhm.
Okay, need my help with that, or you?
We'll see what Terry says when she comes
Fine.
this week and meets with him, see if she's got him, but if not, I'll reach
Fine,
out to
let me
him.
know.
Okay.
I don't think you will, but the offer's there.
Okay.
And I think that's it for health officer.
Good. Moving right along.
To administration?
Yes.
Okay. All right,
Yeah,
so,
before-
you see my report, mostly around, finance, which it's that time of year, it's the time for finance and the time for budgets, and, we just finished up with DOH, and I explained it in the report, that even though we were, authorized $22 million by the legislature, the state was already $300 million, in the hole in the first month after they passed the budget. So, expenses over revenues, and so, they cut ours back to 18 million, and we then had to go back into renegotiating with, the 35 health jurisdictions, 29 tribes, DOH, and the State Board of Health. And it took a couple of meetings, but we got through that, and made appropriations out of the 18 million, and then we made reservations from the 18 million back up to the 22, that the first $3 million is going to go to local public health jurisdictions to really beef up the smallest like us. So we'll go from 42,000 to 100,000. Places like Garfield, Asotin, Ferry, all the tiny locations will have enough to hire at least one full-time person. We have some health jurisdictions that have only 4 people. It was a good agreement, and we got everybody on board. It took some negotiating, but we got there. So we'll go back to the legislature in the spring for it's called a technical correction to the budget, because it was authorized, unfunded. We'll get the funding put in, and we've already talked with the OFM, and they know it's coming, and it's already in their correction. We did talk with Department of Health about Group B water systems. Now, Alex talked about that last time he was here, about we don't have the money to do, it's called a joint powers resolution with Department of Health, and we're going to hand it back to them. And in my conversations with Clark Halverson, who is the Assistant Secretary for Environmental Health, he found enough money in his budget to go ahead and fund us to do the work for this next year. So we'll go ahead and keep moving forward with our Group B program for the next year until we can get it into a regular budget through the legislature.
Yeah, good.
So DOH stepped up to the plate and helped out. We've got some more work to do along those lines with shellfish. The National Estuary Program was bumped from 28 million to 33 million, but it's going through a new grant process because the grants change every 2 years, and they'll align those based on the shellfish areas in the whole sound based on need. So it depends on where we fall in the need category.
Right.
So we'll see what that looks like. I have talked with Dr. Stein about my concern around chronic disease. We just aren't doing much in chronic disease work. And I think that's a place where, as we get into the community forum, and I spoke with the hospital, well, last month, I think, about making that maybe one of the focus of the community forum, because it really requires a change of culture, not a program or a process or a policy. It really is a cultural thing to start swinging that around.
Is this part of the community needs assessment you're talking about?
Yeah, well, it's part of the community needs
They're
assessment,
having
it's
a spin-off from that process of a
Right.
community, yeah.
It's more of not assessment, but doing something
Right.
about the assessment.
right. We had the assessment. We know what's killing us. You know, it's heart disease, it's obesity, it's diabetes are our three biggest killers, and it's all lifestyle things. So it's time to start addressing lifestyle. And we used to get funding to do that, but it's not the big sexy thing
And
anymore.
the real problem with trying to do that is it takes years to actually see the needle change, so people don't go after that. It's not the low-hanging fruit.
Right, and it's difficult to get money from the
it's
legislature to
very
do something
important.
that doesn't have results in the same
Sure.
election
Year.
cycle.
Sure.
Yeah.
I think we are required by a hospital district every 3 years to have a community needs assessment.
Yeah, it has to be signed off by
So-
local public health, yeah.
So this is fresh eyes. Let's take a look at what we're doing. Let's look at the opioid initiatives we're doing. Are they working? What can we do to help support that, moving along? We need to change, as you say, Peggy, our stream a little bit as we swim upstream.
Right, so as the hospital completes its assessment, we'll look at doing some community outreach to
Yeah.
get some community feedback.
Yep.
And what I've seen in the past when I was working with Providence is we came out with great data that showed what the needs in the community were. We had the needs assessment all done, and we took it out to the community, and they went, well, that's nice,
Yeah.
but here's what our needs are, and they wrote down, you know, and it was kind of an eye opener.
Yeah.
So, and of those things, the top two were always mental health and housing.
Yeah.
And then the third one would vary between jobs or drugs or whatever, but the top two were always mental health and housing. Which hospital couldn't do much about housing.
Well, one room at a time.
So, but the hospital did start working.
Thank you. Thank you.
I got it.
Okay.
But the hospital did start working on some mental health issues and changed some of their focus to
Yeah.
start to bring those issues in underneath the healthcare umbrella. So, and I know I've talked with Eric, and he's already on board with that as well. So.
Yep. Yeah, we're looking forward, quite frankly, we're looking forward to strengthen that relationship between this group and the hospital and what we can do to really go ahead and move the needle, as you say.
So that's kind of the focus that we're pushing
Health coalition.
with the community forum. Is it needs to quit being a planning and
Yes.
granting and that kind of an organization and really
Yes.
be let's get something done.
Yep.
In much the same way that the opioid group is
Yes,
getting things
yes.
done. So we're going to move down that road. We kind of took July and set it aside because there's nobody around.
Sure.
So we're going to jump back in. I think October, August.
August, and then a meeting, the
We're thinking
forum.
about a big kickoff event in October, potentially.
We were going to do it in alignment with the opioids, but that's not going to work out exactly right. So we're going to do something and make it a big event, probably at Alderbrook or someplace, you know, that's central to the whole county.
Right, right.
And
But I'll be reaching out to each and every one of you individually to make sure that the date that we pick works for you, because you're very important people that we want at that meeting. So
right.
I'll make sure it works with your schedule.
So the biggest my biggest things right now, again, are finance and then the community forum to
Yeah.
start addressing those,
Chronic.
the chronic disease stuff, you know, because when I read every single death certificate, and in many ways, we're living long enough to get cancer. So, we have people who are you know, over 75, we're doing really good at getting people past 75, and then they live long enough to get these other
Right.
things. But we've got this group that's less than 75 that's really having a hard time with diabetes and heart disease. You know, we've got people in their 50s with heart disease and COPD, and it's lifestyle.
Sure.
So that's a good place for us to work.
Dave, you've done a good job of reaching out and coordinating the efforts of with the state legislature on funding and initiatives and getting them to understand. And I know it took a lot of work on your part, but you know, we thank you for that.
And thanks. What's nice is it's now going to be permanent funding on that funding is coming in, so
Yeah,
it's going to be
that's-
within
That's even better.
the budget, so. What it does is, in some ways, it's like carrot and stick.
Yeah.
You know, it forces DOH and the local counties to have to agree. In fact, we just sent the letter this week that we agree on the priorities for the next year, which allows us to draw the money. If we don't agree, OFM does not release the money.
Mm.
So
Good.
it makes us ensure a partnership. First time that the state has ever entered into an agreement like that with the counties.
Good job.
And that's it for me.
Okay. Any questions of Dave before we move on? Okay. Thank you, sir. Environmental health report.
So Alex is out. He's taking care of some environmental health things. So
Don't want to know more about it. That's fine.
yeah,
Just-
right.
That's good
I'll
right
just
there.
go with that.
Yeah.
We're working on some water quality things. We're looking at water quality staffing and looking at how to fund in a sustainable way the water quality staffing. We don't want to lose our shellfish beds and get any more downgrades. We've had some good work being done. We've got some upgrades, so we're going to try to keep that moving forward. Alex is getting connected with the other environmental health directors because he's only a year into this position, so connected there. Again, the Group B water system piece is good news for his folks as well. Things are kind of just cruising along. We have some oddball things come in from time to time, and Alex is doing a good job of handling those.
Good.
So,
Good
anything
report.
from a bat bit my horse. What do I do? You know, that kind of stuff is just really
Yeah.
odd things.
Yeah. Okay. Any questions on the environmental health report? Boy, we're just clicking right along. Lydia,
So community, health and human services, you've got my report. Does anybody have any questions about my report? And I have one question for you. Is it too small of type? Do you want me to make it bigger? I just was looking at it going, oh, it's pretty small.
I don't know, I can read it.
Everybody okay?
Yeah.
Okay, just like I'll make it bigger if
Thank
it's
you.
too small.
If you make it bigger type, you're gonna have a lot more.
You're gonna have more pages, that's kind of why I kind of trim it down.
It'd make it look like way more work.
Yeah, that's true.
Hey, Kevin.
Not that there's a shortage of it, but.
Yeah. So I guess I'll just highlight on page 4, our stakeholders meeting for the opioid was this month, and it was, gosh, they just keep getting better and better. I can't, just kind of amazing the number of people that show up. This particular one we focused on, we invited in the managed care organizations to talk about the big change in behavioral health for our Medicaid population and the change that the Healthcare Authority took over from the Behavioral Health Organization, the BHO, and they're taking it in 2020 over. We're the last region to switch, which I heard that there was a lot of complaints about that originally when they chose to be the last, but we're definitely benefiting from it because they've had to go through all the hardships in the other regions
Sure.
to figure out how to make this work. So it's a big change for all our behavioral health providers in the community, our mental health providers in the next 4 months, 5 months, because many of them have to get signed up with managed care organizations to get paid for the services they do. They have to get contracts with those managed care. So we invited them in even though it was broader than just opioid, all those agencies are present at our stakeholders meetings. So we invited in the MCOs and HCA, the Healthcare Authority, in to speak. And it turned out really well. They had good questions. We had them send the questions in advance. We asked a lot of questions. They assured everybody it's going to go smoother than it did in some of the other regions, which it probably will.
Sure.
But there's a lot of nervousness amongst the agencies, especially smaller agencies that could possibly, when they hear things like, oh, you won't be paid for 6 months. So obviously this happened already in healthcare, in medical care years ago, where the MCOs now, we have certain ones that operate in each county. We have 3 and 4 when you add in foster care that operate in this county. And they change over the years, and the people who are accessing services can change monthly if they want to between the organizations. So our hospitals, our clinics, they've been working these systems for a while, but our behavioral health organizations and our mental health organizations have not. So it's a little bit harder thinking for them to make that switch. The other thing is the behavioral health organization, which Commissioner Schuette can probably speak to this more, is they supplement and pay for things that Medicaid or Medicare do not pay for. And that they've lost a lot of their funding in this changeover to the managed care organization. So there's some nervousness about what's going to happen to these clients that fall through the cracks, and the BHO is going to have the funding. So that's one of the areas where we're going to be looking at our treatment sales tax funding to go to. We normally RFP out some of that money annually. A year and a half ago, when we did that contract, we knew this was coming. We normally would have RFP'd out right now in July. They would have started a new contract, but we told all the agencies that got that money that we were going to end their contracts at December 19, because we didn't know if we would need that money to supplement some of the other. We're still learning about that right now, still kind of exploring it, working closely with the behavioral health organization and our agencies, and we're just going to watch. The meeting, at the stakeholders meeting, like I said, had great attendance. And people seemed like they got questions answered and felt a little bit better. There's a group being pulled together, a leadership group from all the agencies, from the BHO, from the Healthcare Authority, and the MCOs that will be meeting the whole. We're going to start ours now, and then through that first 6 months, they're going to be meeting regularly to talk about any problems they're having. Payment for the agencies is always one of the biggest things that people are very concerned about. Because a small agency can't, if you don't, like as a county, sometimes we don't get paid for 6 months for things. That's tough, but a small agency can't possibly survive on things like that. So working on that together as a community, and I think there was a really good response, and the community seems to be coming together. We have some of the agencies, Consejo, one of our smaller agencies, but who's in other counties. They've already done this in some of the other regions. So they're going to kind of be helping along some of the agencies, teaching them what they need to do to make sure they're accepted by the managed care organization in a contract thing. So that's something we're very focused on, because we don't want a drop in our ability to serve people in the community. So
Very good.
very big focus for my.
I do have a concern in that when the MCOs take over, we lose people who can actually build beds. You know, that piece goes away when the BHOs go away. You know, how do we come up with the infrastructure?
Mm-hmm.
And CPAA is working on that. In fact, I think they're at the Attorney General's office today to talk to them about the possibility of building 4 large regional treatment hubs. But I'm not sure that all the details like sustainability, those sorts of things have been worked out. But the concept is to have 4 of these hubs across the state that would be on 40 acres and, you know, would complete wraparound services. Great treatment plan, but how do we pay for it?
Mm-hmm.
So they're having a conversation today to see how far the AG's office is willing to go to get something up and running, when we consider that Western is out.
Yeah.
So,
It's down now.
so
Completely?
I don't know if it's completely
No,
down.
there's still good services
Yeah.
at Western, but it's reduced
Yeah.
dramatically. They put a certain group of people are now in the communities, and we're responsible for them in the community. And our treatment center, our evaluation treatment center for mental health is now still trying to get, but it's November now is our target date, right?
What the city says.
Yeah. For opening, so.
I have a question. The old PUD building,
That's the evaluation treatment center.
that's the evaluation, okay. And then the one behind it, where engineering was, what is?
The
what's
one
the-
behind it, that's North Mason Resources. They're a substance use inpatient treatment and outpatient treatment center that have been around for a long time.
They've been in that building a long time?
The one that's behind the old
Yeah,
PUD.
right.
Yeah, they've been there for a while.
Oh, okay.
Yeah. They're one of our major, they're our only inpatient substance use treatment in Mason County at
Who
this
did you
point.
say their name was?
Thank you.
not
Northwest
North Mason.
Resources. I've
I
been
knew
talking
that
to
was
Steve
wrong.
all day. Northwest Resources. Yeah, they're a substance use treatment provider, one of them.
And they're countywide then, they take in people from
They can take in people from out of county too.
out of county?
Yeah.
too?
Yeah,
Yeah.
yeah, they're an open.
Anything else, Letty?
Oh, I think that's it.
Thank you. Good report. Any questions, Woody? Okay, Dave,
Back to me
we're
again.
back to you again.
Improvement funding, we've really kind of already covered that.
Okay.
The legislature we did talk to OFM, and OFM said they just missed it. They forgot to put it in the package that went to the legislature. So, DOH will fund it this year, and they hope to do a technical correction, get it in for next year, so, we should continue to march after DOH's piece runs out. So, that's good news.
Anything else?
That's it.
That's it? We're down to the proclamation?
So I'm going to give a little background information real
Good,
quick.
please.
The week of, actually not the week of, I'm sorry, August 31st is National Opioid Overdose Awareness Day. So in Mason County, we were hoping, with your approval, that we would make August Overdose Awareness Month in Mason County. And we're planning to hold two big events at the end of the month. One is on the 28th. In Belfair, and then the other is on the 29th in Shelton, and these are going to be two overdose awareness walks and resource fairs in combination. So, let me read the proclamation real quick.
That-
So, whereas
Should
Mason,
we, one sec.
Yeah.
Should we have the proclamation be in effect before those community events?
right, yeah, that's right.
For the
That-
whole month, because it's for the whole month of
All of
August.
Oh, okay, all right.
Yes. So, okay. Whereas Mason County recognizes August 31st, 2019 as International Overdose Awareness Day, whereas the aim of International Overdose Awareness Day is to raise awareness, reduce the stigma of drug-related deaths, remember those who have died or suffered permanent injury because of drug overdose, and encourage discussion about overdose prevention and drug policy. Whereas overdose is now the leading cause of accidental death in the United States and the 5th leading cause of death overall, whereas no community is immune to drug overdose, including our own, whereas to raise awareness and fight the stigma surrounding overdose, community members can attend our Overdose Awareness Walk and Resource Fair in Belfair on August 28th and in Shelton on August 29th, both starting at 4 p.m. Now, therefore, the Mason County Board of Health does hereby proclaim August 31st, 2019 as International Overdose Awareness Day and the month of August Overdose Awareness Month in Mason County. We call upon the people of Mason County to observe this month by helping our families, friends, neighbors, co-workers, and leaders better understand overdose, how it affects our community, and how it may be prevented.
Good job, thank you. Is there a motion to accept the proclamation?
Yes, I make a motion, we accept the proclamation for Overdose Awareness Month.
I'll second it.
Thank you. All in favor?
Aye.
And the fairs are both being attended by all the providers in the community. They're very excited about it, and they're kind of putting it all together, so.
How are you getting the word out to the community?
You know that?
Yeah, so we've got 2 Facebook events going on right now. I believe Abe has been distributing flyers as well, but we're trying something new where we're using Facebook advertisement. So we're actually paying for advertisement on Facebook to target Mason County residents. So the
Good.
event is popping up into people's news feeds. So you may have seen it.
Good.
And we'll have some press releases and
Yeah.
things going out too.
And they gave out information at the last opioid.
Yes, at the opioid stakeholders meeting we went out.
Yes.
Good. Mason Web TV be part of that
We're doing radio.
Doing
information?
radio spots with them.
Yeah, radio as well.
Are you ever in contact
Oh,
with
not with you
the
guys.
school district communications liaison person?
We have not been, but that would be great if you could get us into contact with them.
Yeah, that
And they'd
would-
be
yeah.
willing to put it out there.
Her name's Katie, and they
Okay.
do send emails out to anybody that's got a registered email address
Okay.
within the school district, and they also have their own online newsletters and things like that too, so it would reach a lot of people.
Okay.
I think Ben's working with her because
Katie.
we were talking
Ben
about
might be.
utilizing, we learned about that and they said they'd like to start sending more things out to the parents, yeah.
Okay.
And I know
that'd
the
be
North Mason School District sends out emails too, so.
Okay. I'll check with Ben and see if he's
Into your
can look into that for me.
When
What's that?
all of us register
I got a stamp.
kids for school, we give them our contact information.
Gotcha.
And you sign up
That's
to be a
sneaky.
part of that while we get email communications about our schools.
Good. I like it.
So, and emergencies and things like that,
Sure. School closures.
bus issues. There's all sorts, there's a number of things.
Other business and board discussions. Would it be appropriate to have Abe come back in 2 months and just give us an update of what his,
Yes, and he
Initiatives
would
are-
have been here today, except he's out on the mobile outreach today because the other staff member is
Good,
on
okay.
a family medical leave. So, yeah, as a matter of fact, we're trying to figure out, we may make it November just because our first year of our COPE grant, all our data is gonna come together in October. And we are hoping to put out a big report out, and that would be something we'd really want to share
Good.
with the Board of Health. And because we have an evaluator that's part of our project, and so some of the data that we haven't been releasing yet because we're wanting to collect for at least a year. And I just have to commend our providers that are not being paid a dime and are collecting wonderful data for us. And they're just timely, and we're so thrilled with all of them collecting this data from the clients so that we can have a good look. I just got some because we have 2 COPE reports due next Tuesday, and I was just finalizing the reports. And we have over 1,200 now unduplicated people that have been serviced for substance use disorder among our providers. That is a piece of data we have never had before. We have
Great.
never known how many
Wow.
are in treatment in our communities. So, and that's just, that's Medicaid treatment. So obviously there's people also that are in treatment that is private pay or private insurance, so.
Okay.
But we're excited.
We'll look forward to Abe's report. Thank you, Lydia. Before we go to public comment, anything else to come before?
So, WSPHA is coming up in October, and this is the first time we're probably going to send 4 or 5 of us, 5 of us, to WSPHA, Washington State Public Health Association. It's 3 days of training. I'm speaking. So
Abe's speaking, Christina's speaking,
yeah,
they've
so
been
I mean,
invited to speak.
so
Good
Mason
representation.
County is stepping up.
Nice.
Good.
Yeah, it's we bring a different perspective
Yes.
than it's typically a lot of it's not Homer peers.
Yeah.
So
You realize you snicker when you say that?
yeah, yeah.
Here's
He
how it
wrinkled
really
his
is out
nose
in
a
the
little
field.
bit.
So, WSPHA has a new executive director who was the Snohomish County person in my position, who stepped down last month, and he's now the executive director of the WSPHA, which is great to have somebody who's I'm good friends with, and we'll have I think that will really help that relationship too.
Okay.
Hopefully they'll bring the cost down.
Yeah, that's the other thing,
It's
is
terribly
it is a
expensive,
spending conference.
almost $500 a person. just to
much?
go. Almost $500.
Where's the conference held this year?
It's always in the same place,
In
it's in
Wenatchee.
Wenatchee.
Wenatchee, at the
Always
conference
Wenatchee.
center?
So, I think that's it.
Okay. Tom, anything good for the public comment out here?
Yes, and thank you for the opportunity.
Yes, sir.
I actually came here to meet the new public health officer. I was hoping, I was looking forward to a new public health officer, to be quite candid with you, someone who would be engaged in a little bit more than in the past, a little bit more proactive in the past. So I was hoping to do that, but he's not here, so I'll wait till the next meeting. However, since I am here, I'd like to be a little bit of a sounding board at one of your efforts. My passion lately here as far as public health is cessation of smoking. And we used to have banners, we used to have signs. The other day I was traveling behind an MTA bus and I saw this placard and I said, wow, this is the first time I've seen this really, you know, somebody's really thinking about it. And it was very good. I was very, very pleased to see that. The graphics and the message that said, vaping is not as harmless as you think. And I thought to myself, I'm 16 years old and I read that, what does that mean to me? Normally you have a definitive sentence saying that, you know, it is harmless, not as harmless as you think. And it makes you look stupid, which what I would have put on there also. But that aside, I do want to say that just as a citizen, we notice these kind of things. We notice when there's a void, when there's not those kind of things. An outreach program, we also notice when there is, and so I really appreciate that doing you're reaching out to the public, and as you know, when you're on the side of a bus, you read it no matter what it is. The other thing that I'd just like to bring up is we need a little bit more cooperation along the lines of keep people from smoking from our state legislators. We had two bills that involved vaping, House Bill 1774 and House Bill 1873. One spoke to the age making vaping 21 as with smoking, and the other one spoke to taxing vaping the same as smoking, and I spoke in support of both those bills, and both those bills passed, but one of our representatives in the 35th district spoke against both of them. I don't think that's a good idea, and I don't think that's really what we want to do when we're working as a team, both the public and at the state legislature side and the county side and the public health side. I think we all need to be on the same message. Now, I know there's other priorities, there are business priorities, there are taxing priorities, there are political priorities, but this should transcend all those priorities. That representative should be standing up and saying, smoking is bad for you, vaping is bad for you, and I will not support anything that has to do with it. I'm fairly, as you can tell, adamant about that, and I'll be there next year too to make that point. Thank you.
Thank you, Tom.
So Allison's the one that got the bus ads on.
I'm sorry?
Allison is the one here that got the bus ads put up.
Oh,
So,
Yes.
yeah.
So-
thank you, very nice.
So we do have a couple of grants that are working on that
Yeah.
currently, so we haven't forgotten, but yes, it would be lovely if the legislature would give us more funding.
I think that concludes our meeting in record time. We have a motion for adjournment.
So moved.
Second.
All in favor?
Aye.
Thank you for your attendance. See you in 2 months.
Very nice.